Today is Tuesday, the 6th of February 2024. Hello and welcome to Good Morning Sierra Leone, your breakfast show that always starts your day with analysis and views on issues of national concern. I am Frances Bernard, and our quote of the day is from an American singer and guitarist, Willie Nelson, and it says, "Once you replace negative thoughts with positive ones, you will start having positive results." Coming up in today's program, as today is International Day of Zero Tolerance for Female Genital Mutilation, FGM, we find out the significance of the day. Ministry of Health, Directorate of Environmental Health and partners launch Healthcare Waste Management Strategic Plan. And we shall be talking to Native Consortium and Research Center as they raise concern over the procurement and running cost of worker-fine buses. These stories plus more are lined up in this edition of the program. You can have your say by sending your comments and views to the number on your screen, or you do follow us on our Facebook page at SRBC Channel 31 Live. The program is Good Morning Sierra Leone. The program is Good Morning Sierra Leone. To participate by sending your questions to the issues we will be discussing here in the next 1 hour. We start with our first issue of the day. The Ministry of Health, through the Directorate of Environmental Health with support from JAPIGO, has launched the Healthcare Waste Management Strategic Plan and inauguration of the high-level technical working group. The launching was to address the challenges posed by healthcare waste and dedication to creating a sustainable and responsible healthcare system. To discuss more on this, we have in the studio Doris Barr from the Ministry of Health. Good morning, Doris, and welcome to the program.
Good morning. And
so let's talk about this healthcare waste management strategic plan that you've launched.
Yeah, thank you so much, and thank you, and good morning, viewers. The Ministry of Health, with support from JAPIGO, developed the strategic plan, which is a 2-year strategic plan in line with the Ministry of Health strategic plan that is looking at 2021 to 2025. And in the development process of the strategic plan, it actually started from 2023 to 2025, and it has been in process. But let me just give you a background or a run-off of why we had to develop a strategic plan. Previously, it has been very challenging in managing healthcare waste, and that is not only for Sierra Leone. This is like a global challenge. Healthcare waste management, normally we call biomedical waste. These are like very hazardous waste that are being generated in healthcare facilities in terms of operations and other treatment centers. And so as a result of that, we found out that we had challenge in terms of having the right document, because if you don't have the right document, it becomes very difficult for you to actually know what you want to do, because the strategic plan or strategic direction is like a roadmap which actually helps us to understand on a step-by-step process what's to be done. Despite the fact it's a living document, meaning as we go along, we can actually review it to see where the gaps are and how we can actually move on. And when you look at the country, Sierra Leone, we have over 1,500 healthcare facilities, and among we also have 30 tertiary hospitals. So just imagine on a daily basis, you have hazardous waste being generated, theaters, shops, and all this stuff. So we found out that even from the segregation point was a challenge, meaning from the point of use, waste was not well segregated. When we talk about segregation, we mean separating the waste in different categories. There are waste which are general waste like papers.
So maybe we need to let the public know what we are talking about. You know what you're talking about, and I know, but we need, for those who might not understand what you're talking about, so what are these wastes we are talking about?
Yeah, so I think I mentioned this. These are waste generated in healthcare facilities,
like
that are hazardous. For example, we have placentas, we have syringes, we have needles, IV empties, and so on.
Okay.
We have waste that are also generated in theaters from operations that are being carried out. These are the waste we call hazardous waste.
Okay.
And if not well managed, if not well taken care of, it can lead to infection of even the ones who are working within the facilities and even the patients. Normally we talk about nosocomial infections, because it's like a vicious cycle which can come back to those patients who are also admitted. So the Ministry of Health is actually very key in terms of how can we manage this waste that will not be able to harm both the workers and also the patients. And that's the reason of getting this strategic plan document, which can actually guide us as to what to do at the various levels. Because when you talk about healthcare waste management, it has to talk from the segregation. That is how you separate the waste. Because in the hospital, it's just like also some part of the home. You have different sorts of waste you generate. There are papers, there are vegetable waste and so on. So in the hospitals, they also have these various categories of waste. Okay. So from the point of view, let's say in the theater, all those wastes that will be generated in the theaters are hazardous. But when you look at the general hospitals, there are other wastes that may not be that hazardous as we think. For example, papers, they use papers every day, they are not hazardous. So the one key thing is that the ministry is key about is how do you segregate this waste? How do you separate this waste, both the hazardous from the non-hazardous or the municipal waste? So this is one thing which the strategic documents can actually guide us into. And we also should know that apart from the hospital or health facility, there are other private hospitals or facilities who are out there and also generate waste. For example, they have clinics, they have pharmacies who generate waste, and rather unfortunately, some of them do not dispose it to the general bin where the hazardous waste or healthcare waste should be disposed of. They dispose of them in the in the general municipal waste, where it can be accessible to community people, and people go there to scavenge and they can remove some of this waste. Like for example, they take the IV drips cord to make key holders. They also take them, and people also go and scavenge even rubbers. Sometimes you see kids holding syringes, yeah. Exactly, and even rubbers, people go and scavenge to take them as for ginger beer or davita and so on. As long as these waste are mixed up with the hazardous waste, it becomes more and more, very key. So the Ministry of Health has been very, very critical to us how best we can address it. So the strategic plan, as I said, is a costed strategic plan which is up to like $10 million, $10,000 million. And as a result of that, we believe Japaigo alone cannot support, but despite the fact it's a 2 years plan, we started since 2023, and part of the implementation of this strategic plan has already started, because we got support from the World Bank, who has provided incinerators. Why we need incinerators? For those who are out there who may not understand, incinerators are there for those hazardous waste to be actually treated and burnt, okay, compared to the other waste. And we are now looking at climate resilience environment, wherein even the technology we are using, it will not emit a lot of green gas emission will be reduced into some extent. So this is what the Ministry of Health is actually looking forward to. And the strategic plan is not only a standalone, it has a technical working group, because previously we found out that we did not have that coordination in terms of people coming together, in terms of various sectors who are involved, who have a role to play in terms of actually vigilancing the disposal of healthcare waste. So we have developed a technical working group, and we also have a plan of the technical working group, clear terms of reference, where we believe that it's not going to only be the responsibility of Ministry of Health. Remember when we had Ebola, Ministry of Health alone was not able to handle it, and we cannot have 4 eyes midnight wherein people will go and deposit hazardous waste into the water streams or in other illegal dumping sites. So we believe we want to look at the technical working group, wherein it involves community leaders, it involves other stakeholders like the local government, different players, okay, who may have a role to play in terms of ensuring that the Ministry of Health will have eyes, or we have soldiers who can be able to actually monitor the proper disposal or handling of this healthcare waste. So,
Madam Pa, you spoke about ways of separating the waste. So in your plans, how do you hope to go about that?
Well, we have already started. The World Bank, the Global Fund, and the World Bank also provided us with waste bins. If you go to hospitals, you have color-coded bins. Okay. They have bins wherein if somebody is working in the hospital, the red bin, what is it? Sometimes we go to the hospital, we don't understand why different color waste bins are there. These bins are there to actually help the healthcare workers to understand which way should go into the particular bin. For example, red, when we see red, we mean it's danger. So those sharps, those needles are being deposited into that bin. You have the ashes color bin, which is for the normal waste, because within the facility they use papers for registration and other things. So those other waste goes into that bin. So that has been recently provided to 10 districts. And when we talk about this, it's looking at the peripheral health units. So we're looking forward to actually supply more, which the World Bank and also Global Fund is ready to support. Some of the bins are also still, we are now distributing them. And also the next which we are doing is the capacity building, training of the healthcare workers. Some of the healthcare workers may not be they are novice in terms of waste segregation at various levels. So we are training them for them to know that they need to, this is the procedure, they need to segregate their waste. And also, again, from the World Bank, Global Fund, a lot of support is being given in terms of how the waste handlers should dispose of this waste at a particular time, because hazardous waste within 24 hours it should be disposed of. So these are some of the modalities that are being put in place.
So now you say the color-coded dustbins in the hospital. It's good you are telling. Even me, I never knew that with those colors they signify that such waste should go in here or over there. And you also have patients who goes to the hospital. They are not aware of what you're saying, and they do sometimes dispose of their waste in some of these bins. How are they going to be informed about it?
Okay, so when the color-coded bins, especially for the hazardous, they are not. We don't. The healthcare workers within the facilities is actually very clear, because that's why we capacitate them, we train them for them to understand. If they get a clear understanding, those coded bins are within a specific strategic points in terms of the hazardous waste. We know that patients will not go where the red zone is. You have various zones to go and dispose of ordinary papers into those bins. So within their own precincts or within their own immediate environs, the bins that are there are those for the general waste. So they don't have access into, they are not the ones giving injections to themselves. So for the hazardous waste. So for the municipal waste or the general waste, there is where they have access in disposing of the type of waste that they themselves generate.
All right, thank you very much. She is Doris Bar, and she is coming from the Ministry of Health, and they have launched a strategic document which will help them to manage healthcare waste, to do healthcare waste management. Well, the program is Good Morning Sierra Leone. You can have your say by sending your comments and views to the number on your screen, or you do follow us on our Facebook page. We'll go to another issue that has to do with I'm sure everyone is interested in this topic. As the Waka Fine bus starts operations, there has been a mixed feeling on the operation of the buses, especially the use of designated corridors and alternative routes. A civil society organization, Native Consortium and Research Center has raised concern over the bus fare, which is 10 leones compared to commercial buses. According to the Native think tank released, the 10 leones fare will give commercial vehicles the leeway to also increase their own fare, which has the tendency to create hardship for citizens. Edmond Abu is in the studio, and we're going to discuss more about this. Good morning, Edmond. Welcome to the program.
Good morning. Thank you very much.
So, before going to your press release, what's your whole idea about this Waka Fine bus that we have in the country?
Well, Francis, as you may be aware, you followed my program for all these years. Native Consortium, we have been on field advocacy for the past 20 years, from the days of Pakaba to date. And our advocacy is not on fear on the product. Our advocacy centers are on the pass-through effect, the increment in the pump price of fuel will have on transport price. That has been the center. So it's like you say, you not look outside for the look outside food. So you look at the cause and effect, the cause. So you limit the dangers of the cause. So over time, Native Consortium will be advocating, fighting with government in and out, and fear. Please, Papa, government increase, because each time you increase the pump price of fuel, there's an increment in the transport fare. That's natural. That's the big driver. That's the 99% driver. So for us, this particular move by the Waka Fine boss, in fact, if it's even putting our advocacy into it's like making our advocacy look useless. The very government-owned enterprise, because if you say when the fare was 20 news, we used to pay. Now it is 150. Now it's 5 news. Pole to pole, for instance, Lumley to Central Town and Calbaton to Central Town, pole to pole. That is a fixed government price. So, Francis, number first is the issue of government-owned regulation. The government-owned regulation. When government puts its own price, the Ministry of Transport, you should respect it, you should obey it. I could have imagined it was the Sarah Star or it was the Milan bus that could have just woke up one morning and say, okay, my own bus fare na 10 euros pole to pole, Lumley to Central Town or Calbaton. The people could have said, oh, na APC then they want to sabotage the government. Oh, no. Government could have clamped down on us seriously, because no private commercial bus would do that, firstly. Second of all, government buses from 1961 all over are supposed government service private delivery service is supposed to be cheaper and affordable. It's supposed, and in fact, firstly we need to commend the Waka Fine bus. It's a good project. Though I understood it was like 50, it was 42 buses now. But also, I'm not going into the nuances of who owns the bus, whether it is government or private. No. Our concern is about the cost, the affordability.
And you're also concerned about the procurement process also.
No, like I said, that's another debate for another day. The common man, the concern of the common man here, Francis, is about the cost and the competition. Government bosses supposed to compete, and in fact, even from the private business point of view, private man, you don't come with a product newly in the market and you make it expensive. No private individual does that. Nobody, let alone a kind of public-private partnership, a government-owned boss, so to say. Yeah, you don't do that. When you do that, what you are doing, the danger, and that is what is putting our advocacy into risk. Because in fact, I'm just telling my management, my body, it's possible some of people just go quiet. Don't say anything anymore. Now just the way they say, well, me are tired, we don't tire. Because how can government bring its own boss? Number first, you violate your own law. Number second, you now put police. You say, okay, you have route. Okay, I have learned new things today. You have route that, okay, we can see road because of so. No, let them compete. Because you don't expect the man that is coming from Lumley to like Collegiate or like Cochrane or like to Aberdeen to pay 10,000 euros, 10 euros pole to pole. No, that's unfair. You understand? You don't expect the man that is coming from Calbaton to Congo Water or PNB or Shell Company to pay the same 10 euros. That's unfair. You understand?
But so they have alternative route.
Yeah, that's now. Well, okay. Even if you have alternate, let us even assume that this bus they are serving shawarma and pizza, or there is AC, they have all the comforts. Because this bus is not as comfortable like the Milan bus and Sierra Star bus. You understand? But let us assume that they have all of this.
Have you used the bus?
Of course, yes. So let us assume they have all of this comfort. You don't need to make it 10 years. Make it 5 years. Adhere to the government own. So I'm saying the Minister of Transport are now urinating on their own law, which is bad. So to us, we are saying, okay, fine, the route, so. But the issue is allow everybody to go. Mark you, the keke rider. I'm not a friend to the keke rider, by the way. I think people knows that because they are extortional, they are very exploitative. But when your government bring your own and you make it more extortional, more exploitative than the poda that is coming from Lumley to Sakila for 5 years, then you're now tempting them now. In fact, now what is happening now? Now when they take the, for instance, the spur route from Lumley, they are not. Some of them are charging 8 million, 10 million. That's not affordable. That's dangerous.
Edmond, are you aware that the buses or the podas that you are talking for?
You work fine.
No, I'm talking about
commercial
podas. Are you aware that if you are taking at Calabar Town, they will not take you to your destination? They will not take you to Eastern Police. Maybe they will take you, if you are taking from Calabar Town, they will take you to
Shell aware.
And from Shell, they will say, okay, we are moving to
I know that.
And by the time you get to Eastern Police, you've paid more than 50.
Or let's say,
are you aware of that?
Of course. In fact, that is why I said the Waka Fine boss should help ameliorate the suffering of the people. You understand? Let us take, for instance, the man that is coming from 55, or that is coming from let's say from 55 post office, DPI Water, Adonkia, Yams Farm, Gokel, they are all coming to Kalbaton or PAB and then take another transport. Now, what is happening when they come to Kalbaton, to let's say PAB now, they are not going to the Uru because they cannot come that far and then come and pay another 10 euros. So they prefer. Now, I know the Minister of Transport, they will not be aware. They will think, oh no, afterwards, people in the queue for the bus, they have to like, because you know why? Because most of the passengers that they take from Longley or from, they are coming direct. These are pole-to-pole passengers. They are not coming halfway. And that, I don't know if they are aware of that. So because they are coming pole-to-pole direct to inside town, for them, the bus is okay. Because most often and not, like you said, most of these commercial poda transport, they are very, in fact, guess what they do? In fact, for Waterloo, the front seat, there's a special price. So I am very, very much. So that is why, as a government, if you are okay, let us say all what government Edmond is saying is stupid, or all what the people are saying is not correct. But just for one thing, obey your own law. Don't urinate on your own law.
All right.
And in fact, there is no justification. Oh, because of I heard from my sister today that because of climate change or because of people sat, because of you have this meeting, because of the corridor. No, that's poppycock. There's no justification for the tell news.
All right, thank you very much, Edmond Abu. Continue to stay with us. Well, in the studio also, we have been to Shamel, and she is coming from. She's the communication specialist for the Iron Project, and she is coming from the Ministry of Transport. Good morning, Madam Shamel, and welcome to the program.
Thank you very much.
So you've patiently listened to Edmond about their concern.
If I should say painfully.
Yes. You're about their concerns as a civil society organization, the costs. In fact, they are more concerned about the cost that you are violating some of the laws that were made by government of which you are part of.
Yes. So Francis, I want for people who this is the first time you're seeing me or hearing me, which I don't think, because I'm here every Monday at 4 and we talk about the project. So this is the Iron Project came with reforms.
Okay.
And it's a pilot. And the pilot corridor is from River Number 2 to bus station and from Jue to bus station. And most of our intervention have focused in those areas. So for instance, you saw us rearrange the arrangements at the Lumley and Ferry Junction. We have constructed the 4-foot bridges to enhance pedestrian safety. We have introduced, we have rearranged intersections, which we call roundabouts, some intersections, and signalized them, installed traffic lights. We have installed street lights and also instituted guardrails to prevent interaction of pedestrians and motorists. All those interventions are part of what this project is about, which one is to improve access to quality public transport systems, 2 to address climate resilience, 3 to look at road safety, and to build capacity of our stakeholders to sustain the gains this project would have made. It's a 4-year project that was being implemented by the Ministry of Transport, and a lot of us have seen some of the changes on roads. Implementation has commenced, and the Chief Minister launched the reforms implementation on Monday last week, 29 January, including the 50 buses. You know, I heard Mr. Abu talk about all the challenges with the existing public transport system, and I'm happy it came from you, Francis, that people are using. We know if you are to come from Calabar town to town, you would have to pay at least between 18 to 20,000 euros. That is the fact. And these are people who have been told that pole to pole is supposed to be 5,000, but they're taking advantage. And we know our keke riders, keke and okada, we know they don't normally stand like every other vehicle.
No, they don't even go by
they don't stand in the, so if they were riding like everybody else does, like everywhere else in the world where people are using the routes and would obey the rules of the road by standing in the queue, you would not take Okada because we all know it is not safe. You would not take Keke because we know the services they're providing. It's too costly for you to pay 20,000 from Calabar Town, or 25,000 Calabar Town to PZ. It's a lot. It's being exploitative. But sometimes we as passengers, we want to go, we're in a hurry. We actually propose a cost. Make I pay 15,000, make I pay 20,000, and we go willingly. Those are all the challenges. And the issue of safety, Frances, I don't know about other people, but I have had people who've had road traffic crashes that have had fatalities. Every day, one of the Budapudas or an Okada would have an accident with somebody that might be fatal, and that person loses their life. We're not going to, the 5,000 extra will not bring them to life. The 5,000, the additional funds that they have will not bring them back to life. The person who has broken the limb will not have, and the limb has been amputated, will not have back their regular limb grow back. All of those are what government has been looking at. And you know what? It is not that government does not know that the Pudapudas are not safe. But if the government was to be very stringent and say we're checking all the vehicles, if you're not roadworthy, we're taking you off. Imagine the hue and cry, not only from the owners of the Pudapuda and buses, but also even the users. So it is that challenge, Francis, that government came with this project to address. So imagine them bringing 50 buses, and honestly, it is not enough. For the corridors, we needed about 150 buses to cover from River Number 2 to bus station and from Jue to bus station. But because we did not have the resources to be able to do all of that, and this is a pilot, we said, okay, let's phase it. Phase 1 would be from Lumley to bus station and Calabar Town to bus station. Still, Francis, you and I know, people from Lumley and Calabar Town are not paying 10,000 on the regular buses to go to town. We know that, and we know the quality of the vehicle that you will pay 5,000 on. Podapodas that have regular seats, they have been removed with iron seats in there, and you are forced to sit on a seat that is a place that is made for 6 people, for 4 people, 6 people my size will be squeezed into that for. And if you complain, we type now and say it's a candon or fenion, all those inconveniences, all what has been given to people, all what has been handed to people in accessing public transport is what governments have looked at and brought a 70-seater bus for a start. So, and Frances, I know one of the challenges a lot of people have spoken about is the cost. Mr. Abu, I think you have made very strong statements, and I will not repeat it on air for the purposes of decency. But I think the ones in your press conference, in your press release also is very strong. You made statements like criminal enterprise, extortion scheme, exploitative. But I'm also happy that you mentioned that the existing public transport operators are already exploiting, and this is the exploitation that we have come to address. Francis, it's 70 buses that is moving 70 people at a time. Those are huge buses. The keke that is moving only 3 people is charging you 20,000. We looked at a middle ground to be ensured we would break even and sustain the buses. So remember, the bus, the existing system cannot replenish itself. The buses will not work enough money or get enough money to add to their fleets. So there's already a fleet renewal scheme where a little bit of what is being acquired as earnings from the fares that will go into fleet renewal scheme, so the buses will replenish themselves.
Okay, so Madam Shamel, are you aware of the challenges faced by people, the very people you want to help, in making sure they don't go through the normal situation that has been operating with the commercial vehicles? Now, as you speak, they are going through a lot of challenges, particularly those in the east, because of the alternate routes given to them.
Yes.
They have been struggling a lot. My colleagues they have done series of stories on that, and it's really somehow chaotic. Are you aware of that?
We are aware.
Are you concerned?
Oh, absolutely, Frances. These are things we looked at before we brought the buses. These are before Christmas last year. All the stakeholders, including SLRA, including Sierra Leone Safety Authority, motor drivers, poda and bus owners association, bike riders, we all went for bus rides on the routes, looking at the challenges, the alternative routes that they had proposed that is ideal for them to be. They had made a proposition that we should fix it. And you know, Ministry of Transport, our niche, our mandate is public transport, but Sierra Leone Roads Authority has the mandate to fix these roads, and we are in consult. They have sent a request to us. They're working on getting that fixed. And
what about those garages along the road?
Again, the reforms that we're introducing addresses all issues like that. The garages, people who are building and pouring their sand or their granite stones on the road, all of those, you and I know there's so many inconveniences that people, because of their inconveniences, don't concern. Those are the things we're looking at implementing. Those are what we looked at introducing. What? To ensure that the others who are using the alternative route also use it safely. It is safe. They're working on removing the speed bumps. They're working on fixing the potholes. They're working on their streets where, because of how we build in Sierra Leone.
Don't you think this should have been done even before the start of the work?
Well, again, the buses came in November, and we know that the problem is acute. If we say we want to fix all the problems before the buses will run, we would not have started yet.
Right,
and we wanted to ensure that the buses address the issue of the huge public transport deficit that we have in Freetown.
All right.
And that is what we're seeing.
Thank you very much. She is Bintu Shamel, and she is communication specialist for the ION project in the Ministry of Transport. The program is Good Morning Sierra Leone. We go for a short commercial break. When we come back, we continue with the discussion.
As a mother of the house,
as always, you can be part of it by following us on our Facebook page at SLBC Channel 31 Live. We continue with the program. We go back to Madam Doris Barr from the Ministry of Health. So now that you've launched this strategic plan for the management of health care waste, so what's next for your institution?
Okay, thank you so much. The next plan we are looking forward to, launching a document is not that enough, because we know most of the time some of these strategic documents for other areas are kept in the shelves and not used. So we don't want to go within those poor or management procedures. We want to ensure that people are aware of what is in the strategic plan, especially not only the partners, but even the users, the end users. So our next plan is to see how we can disseminate it, or we can talk about rolling out.
So how are you going to do that?
We'll be sharing to start. We have already shared to partners the e-copy. We have also printed copies that are going to be shared, and then we'll be having engagement meetings. Remember, I earlier told you that we have a technical working group, and the technical working group, both national and at district level, comprise of various stakeholders, both private sector, both partners, and also the hospital management committee, the stakeholders. So we are going to ensure that all of them are aware with what is in the content of the strategic plan, and because the technical group is there, it will actually like a guide on the step-to-step basis. That means that each level of the technical working group, they can be able to know what are like potential hazards that are occurring, and they are able to address it even with or without funding. So that's the essence why we set up the technical working group, to actually be like a face of the strategic plan document. So these are the procedures we are planning to ensure we roll it out, to ensure that every sector is aware as to what is going on, and make sure that we are not setting a parallel structure. We already have people who, or institutions or sectors that is looking at the One Health approach, who are already be working on waste management or healthcare waste management. So we'll get them involved for them to mainstream what is in it. So one main thing is we have to popularize the document. Okay. Meaning any partner coming into the country, you have to know that the Ministry of Health has a strategic plan document on addressing healthcare waste management. So you don't come with your portfolio having your own activities in mind. We have to tell you that this is what the Ministry of Health has, these are priorities, and if you have any funding, you have to align your activities or your funding with what is in our strategic plan
All right,
document.
finally, before you go, how effective is your ministry to make sure that all what is in that document is being implemented?
Well, that's why still I emphasize on the technical working group, and not only that, we'll be having monitoring. We're going to have joint monitoring to we visit these working groups to actually ensure that they are actually doing the right thing. We have already set up a monitoring framework that we have indicators for reporting. We have developed reporting system, and these indicators what we'll be having from district level, even the national level, as to how many has been done, what has been done, what has been carried out, and on a monthly or on a quarterly basis, we'll be having 20 monitoring visits, both at the national level and at district level, and not even we also going down to the national level, district level, but even the districts, they are going to have their own monitoring system. The monitoring system is not going to be an ad hoc program. It's going to be like mainstream into the normal monitoring interventions that the districts are carrying on. So to actually see, and then in the CWG meetings, they actually see their own challenges. Okay. They're able to address their own challenges. They're able to know why is this happening? Why is the waste from the hospitals not carried to the incinerators? What is the problem? What are the challenges? And these issues are being reported to national level. National level, we have a steering committee. The steering committee comprises of the leadership of the Minister of Health, which has to do with the Chief Medical Officer and other members, and that will be brought up in a management meeting, and that can be presented, and then we can sit down as a whole to see how best are we going to address some of these challenges.
All right, thank you very much. She is Doris Ba, and she's here from the Ministry of Health. Many thanks for being part of the program. We continue to monitor their strategic plan on how to manage healthcare waste. We go to another issue. February 6th, which is today, is the International Day of Zero Tolerance against Female Genital Mutilation. This day provides an opportunity for all stakeholders involved in ending the practice and raise awareness in Sierra Leone. Organizations who are engaged in advocacy for women's rights have come together as a coalition called Forum Against Harmful Practices. To talk more on this year's event, we have in the studios Fatmata Kamara, Communication and Advocacy Assistant, Forum Against Harmful Practices. Good morning, Madam Fatmata. Welcome to the program.
Good morning, viewers.
So, what is FGM for the benefit of our people down there?
Yeah, FGM is female genital mutilation. Normally in a local diet we say bondo. So that is an FGM.
What? Come again?
Female genital mutilation. Normally we call it bondo.
Okay. So today is the International Day of zero tolerance against this practice that we are talking about, FGM. So what are some of the things you put together to mark this day?
Well, like what presently I'm doing, we are doing an advocacy sensitizing people, because this is a fight that we have started long ago, and we've started it since they mark this day since 2012. So we started by saying age of consent. Then we moved to the next step, which is we say no to cutting, because the cutting is very, very harmful. So we are advocating to people, talking to people, calling on the soways, because we normally have meeting with them. We talk with them to stop the cutting, even though they are saying that it is a culture. That's it. The learning process, there is a learning process in the society, because I'm also a victim of the whole process. There is a learning process in the society, but the cutting, that is the thing that is very, very harmful. So we normally call them and talk to them that they should stop the cutting.
This is a very sensitive issue when it comes to third world country like Sierra Leone.
Yeah.
How have you been working to make sure that your advocacy does not go against those in the regions, particularly our cultural people? You just spoke about Soweto. They have their own culture, they have the things that they believe in, and for them this is one of the things that every girl child should go through if you want to become a responsible woman in society. It is a sensitive issue. How have you been working around it to make sure you don't step on the toes of those that this is a no-go area for them?
Yeah, when we normally approach them, we don't talk. There are times if you just approach them and say, "Una left for court, una stop this process, una stop for do this here," they will be very, very angry. So we normally call them, we talk to them that we love the culture. It is her culture. There is a learning process in it, but what we want you to do is to stop the cutting because it has some effects. We talk to them about the effects and the implication that this whole process entails.
So what has gone wrong with the age of consent? Because the government or other institutions, the UN is not saying stop it, but wait for certain age if she is 18. But because we've had stories of young girls as young as 9, 8 dying during the process of this practice that we are talking about. What do you think has gone wrong with that, and what are you doing to make sure you work with governments and other partners so you keep educating these people to wait for that age of consent?
The age of consent is like just like what you have been saying, from the below the age of 18. But if we look at, there are different cases wherein women have been losing their lives even though they have been above the age because they normally force them. At times they will just call them as, I want to see you. Maybe their relative, they will be there like, I want to see you in the province. When they went there, they would just initiate her without even asking for her own opinions. They will be saying like, you are above the age, so even if we initiate you, there's nothing they are going to do, or there is nothing that is going to happen. So that's why they now we are not advocating for the age of consent, but we are advocating for a total abolishment of the whole practice.
Yeah, that is. So what steps have you taken?
We have been talking to some surveys in the province, because FAB is a coalition that is made up of 26 organizations. I am from the Girl to Girl Empowerment Movement. We are also part of the coalition. So the issue of this whole process is more practice in the province. Lately, in January, in
Gambia, we have
a case where two people lost their life during the whole. Two girls lost their life in the process. So we are still calling on them, advocating to them, because when there was this issue of the age of consent, but yet still people are doing the same thing, then we introduced the yellow bundle.
What is yellow bundle?
The yellow bundle is wherein they don't do the cutting, but you do the whole.
Has that been practiced in Sierra Leone?
Yes. Okay. In the province.
All right. Thank you very much, Fatmata. Continue to stay with us. We continue with the program, and we go back to my two friends, Edmond and Madam Batu Shamel, in the studio. Edmond, you had Madam Shamel talking about, she took her time to go through to explain about some of the things those you are advocating for have been going through in the hands of these commercial vehicles. In fact, you said you don't like the kekes.
No, not that I don't like.
They are not your friends.
Exploitation.
Yes, they are not your friends because of they exploit money from people. So you've listened to her, and she spoke about all the things they have done in making sure they get the alternative route for other commercial vehicles to use them and to make it effective. You've listened to her.
Yes, I think she made brilliant point. But let us not understate this. Let us not underrate this point that Keke and Okada have saved so many lives. Pregnant women from hard to reach areas that don't, and in fact, in this social status, there are people who don't use buses, no matter how you do those buses. So the Ministry of Transport should accept that one first. There are some people, even with the poda, they will tell you, I don't know how well I use poda. Because for them, the status, they cannot use bus anymore. They prefer to use keke or bike, because the Okada, it takes them right to their doorstep.
So why do you think people don't want to use bus? If we are talking about, because Madam Shamel spoke about quality. I actually underlined that word, that they want to provide quality. Why do you think people?
No, this bus is like any other buses. There's nothing extraordinary about this Waka Fine bus. There's nothing extraordinary.
Why do you think? They
need about 150 buses.
If we have a situation where you don't have your vehicle, you have those podas and you have the Waka.
So to get here, I took keke, because even the Waka Fine bus was on the traffic. I took to come to be here by 7:30. Salma was calling me. I have to take bike. Okada to take me right here to SLBC. So let us don't underestimate keke or their importance.
Are you along the corridors?
I'll stay around with Kinsey Road Collegiate. Okay. I'm talking of the corridor. Now, in fact, when the door is to, in fact, when the keke pass after Aberdeen Road, they charge them 500,000 euros, and that is what I call criminal enterprise. I'll let all of them compete. If you believe that your service is here to help the suffering of the people, then compete with the others. So when you compete, you make your service cheaper, affordable, or if let us say you cannot even make it cheaper, but just start your price at the price of the Minister of Transport. It's as simple as thinking, Mampama.
Okay, so what do you want them to do now?
Fine.
We don't have enough time.
Yes, just put the price back to 500. Just respect your own law. Just respect your own transport peer. There is a price.
Are you concerned about quality?
Me, I don't understand. What you think they serve pizza in this bus or shawarma? So this bus is just like any other bus, like the Logos fake bus she brought, like any other buses. This bus is not like, it's just because of the name Waka Fine, because the Waka Fine. Yeah, in fact, she's talking about sustainability. You don't talk about, we only look at the sustainability part of this bus after 1-2 years, not now. She's talking about all replacement. Logos talk pasu. Logos talk about clinic, mobile garage, that they have guys that move with the buses. We saw other buses, and all of them, but they end up to be scrapped. Right. So we are hoping. I'm very positive. I'm very optimistic that this bus will serve us, and let us celebrate this bus. But the reason why people are not celebrating it is because it's created this whole huge and cry. Okay. Just around price. Just put the price. It's as simple as drinking Mapama. Put the price to 5 euros. Just the normal price, pole to pole. Lonely. So yes, Lonely to Central Town, and then Calbaton to PNB to Central Town. 5 euros. Respect your own law. It's as simple as that. All this explanation that it was a World Bank project, they call this MI, and they call Obama and Biden to come and sit. It's just not hard enough.
Thank you very much. And now we go back to you. But 2 time is not in our favor.
Yes, but I really enjoy Mr. Abu's energy. I think what we need to underscore here, Francis, is the fact that the Waka Fine buses is using a pilot project corridor where we have done several interventions, and we are trying it everywhere in the world. There are public transportation systems that are organized, that are standard, that have a standard that you have to deliver, and that is what we're piloting. And we did not go up, we did not go down, for a couple of reasons. But 2 of the reasons is, one, that we can break even, and it is affordable. To ensure we look at affordability, there is also, we did not take away the options. Francis, the 5,000 poda is still running as we speak. The keke is still running at 20,000. No, they're not. It is the pilot corridor that we're doing the reforms. Okay. So we want to see how we can do. So, Mr. Abu, everywhere you go to the developed world and you see and we admire. And these are things we want to introduce. We are piloting. This is a pilot for we are doing, and we want to see how it works. Francis, I bet you want to come to work with a transport that is predictable. You know you're coming.
But
here
you just spoke about the bus being in traffic. Is that true?
There should not be traffic, Frances. If you're imagine if you're moving 70 people would have to sit in at least 30 vehicles. 70 people will have to do 70 kekes or okadas, all of those on the routes. How can you have traffic if I rode on Wilkinson Road? I rode on Wilkinson Road yesterday at peak time, and honestly, the only place where you have the traffic is when you're approaching the intersections. For instance, when the roundabout, yes, Abadi Road and Moriton Junction, those intersections. Imagine others are coming as well, so you would meet. But people who rode on Wilkinson Road know there is no traffic.
People have also been buying tickets.
Yes.
They are not able to use the buses.
I think those are the issues, Frances, we should be looking at, and that is what we're working on. Today I have missed on supporting the people, the teams working out there. There are so many issues. This is a new initiative.
Are you going to get a review?
We're looking at how we can make sure when you buy your ticket you get on the bus. We're looking at how we can ensure our headway that we have said.
How soon are we expecting more buses?
I will not say on air that we're expecting buses tomorrow. I will not say we're expecting buses in 3 months. Let us use the 50 that we have to the best of our ability, and let us. It's a process. We know if we keep contributing, the company will have enough resources to add to the fleet, and I think that is what we should be looking at. We have small problems that we're fixing. We're trying to fix. We're fixing a big problem of we're moving over 50,000 people every day, for instance, and I think that's small issues like tickets, the timing. Those are issues we're trying to fix.
Right.
But the issue about cost, I think people have said in our research that we did before we launched this project that cost is the fourth thing they will think about. The first thing is availability.
All right.
The second, safety.
Thank you very
which are all the
much,
things we're
Madam
looking at,
Shamel.
Frances.
Thank you very much. She is Matu Shamel, and she is the communication specialist for the Iron Project, and also we have Fatmata Kamara coming from Forum Against Harmful Practices, as today is the day. It's the International Day of Zero Tolerance Against Female Genital Mutilation, and she is from FAB. And also we had Edmond Abu from Native Consortium. Thank you very much, ladies and gentlemen, for making it to the program. On behalf of the production team, especially our producer, Joseph Stanley, I have been your presenter, Francis Banner. But before I go, quickly a reminder of our quote of the day, which came from an American singer and guitarist, Willie Nelson, and it says, once you replace negative thoughts with positive ones, you start having positive results. Do have a lovely and wonderful day. Good